Hey, everybody. Welcome back to another episode of Teaching Tips Tuesday. I have another really exciting one for you today. This is unofficially part two of my Living Legends series. The first, of course, was Donna Sauerberger, and now we have the Dr. Sandra Lewis. How you doing today, Dr. Lewis?
I'm doing fine. How are you, Alex?
I'm doing very well. Thank you for asking, and thank you so much for being on.
You're welcome. I'm happy to be here.
So just to briefly go over your CV, I know that you helped to found the ECC in the United States, which is pretty. I don't know how else to introduce that besides it's. If you look at that ECC Essentials textbook, you'll see Sandra Lewis right there on the front of that. You are and have been for some time the editor in chief of the journal Visual Impairments and Blindness.
Mm-hmm.
You led the FSU vision team for quite some
28,
time.
28 years.
28 years. That's a lot of TVIs. I can personally say that I have you were my braille instructor and you helped me. I'd say you're probably one of the biggest reasons that I am in this field that I am today. So I want to thank you for that as well.
Well, thank you. It's always a pleasure to see my graduates do well when they're done. So,
And believe me when I say that is just scratching the surface. I mean, you've been published tons and tons of times. You were on the Florida Council for Determining UEB Braille. Let me tell you, folks at home, this is no average TVI that we're interviewing today.
but you
And
know what? I want to tell you, I still see myself as a TVI at
huh,
heart. You know,
after all this stuff,
yeah,
you're
yeah,
just a
yeah.
normal.
When anybody asks me what I do, I tell them first that I teach kids with visual impairments, so.
Well, that's so cool.
Yeah.
And teaching kids with visual impairments is what we want to talk about today. When we were kind of talking through topics for today, you said something that really affected my perception, and that was that people are not teaching our students. You go ahead and explain it your own way. I feel like I'm going to mess up your words.
Well, I think you asked me what is it that people need to know about teaching students with visual impairments, and what I responded was that I think that what it's really hard for all teachers to do, including teachers of students with visual impairments and O&M specialists, is to realize that children who are blind and many children with low vision experience the world very, very differently. And we're so vision centric in our way of thinking because we depend so much
What
on
evolution made us, yeah.
everything, that's how we are, that it's really, really difficult to perceive how children who are blind and kids with low vision perceive the world. And it's not just that you can close your eyes and, oh, it's dark and I can walk from my desk
That's
to
just
the
what it's
door.
like, yeah.
That's not it. It's what that does to all of your interactions in the world, especially when you have congenital impairments. What you know about the world, what you know about other people, how you interact with the world, and so it's. I think too often teachers just kind of impose their own experiences and assume that that's the way these children. The same is true for these children, and it's not.
Yeah, and it's not just the way their vision is now, it's the way their vision has been their entire life and
Right.
what are the implications of that. So so we know this now. We know that many of these teachers are not considering this lifetime mental difference. What do we do about that?
Um, well, you. I think you have to figure out how they do experience the world and
You
what
gotta assess.
you got to assess
Yeah.
and what that experience, how that experience has impacted what they know. And then of course you get to provide you get to provide different you get to provide the instruction that they need, doing it in a way that takes into that visual history, that current visual functioning into consideration. And a good part of that, of course, is to teach the skills related to the expanded core curriculum. That's what many children with visual impairments miss because they don't see the world in the same way the rest of us do.
Now, I've had a lot of people on this show explain what the ECC is, but there is no person in the world I would rather have define the ECC than you, Dr. Lewis.
um, so Al, I always think of the ECC as the potential areas where children with visual impairments may need specialized instruction because of their inability or limited ability to learn incidentally just from watching the rest of the world. It's not everybody needs every one of the skills, although when I worked at the assessment center at the California School for the Blind, and I never found a child who didn't have some gap that needed addressing related to the ECC. But almost all kids, so almost all children need to have systematic instruction over time in these areas that's planned, obviously,
Yeah.
and that results. I mean, in order to result in as much independence as possible for that child when that child's an adult. I don't know if you remember it, but a big deal for me in my classes was to always think about that future adult.
Begin
Not
with the end in mind. I am legitimately thinking
you,
of where I'm going to have that tattooed on my body. That is a legitimate comment. That has changed philosophically my entire life. So yeah,
yeah,
I remember that very clearly.
because they're cute right now. They're not always cute when they're 18 and they don't have
Oh
skills.
no, yeah.
And it's when they're 18 and over that they're going to need all those skills. And it's not fair to wait and teach them and expect them to learn like they could learn everything they need to do after
Hmm.
18 years of being taken care of. So
You can't all of a sudden whip independence on somebody and affect it to stick. Yeah.
no, you can.
And I have definitely learned that. I've had a couple 16, 17-year-olds come onto my caseload who have not received ECC instruction, and it shows.
It just blows your mind, doesn't it?
Hmm. You see the giant void that needs to be filled and needs to be filled rapidly
And
because
it
those
can't.
TBI services are going to disappear pretty soon.
And yet we continue to promote as a model of instruction for these children summer school, after school, weekend, and that may not be. I mean, that's better than nothing, obviously, but it has to be carefully planned, systematic.
Yeah.
It has to keep that end in mind. It's easy to say, oh, we won't work on career skills when you've got a fourth grader, but you really need to be working on career skills for that
They need
kiddo.
to know that there is a world of career options, and they need to
That's
know
right.
that different things require different skills.
That's right. That's right. Mm-hmm.
You're maybe not teaching like how to use Excel for data entry, but you are teaching that there are careers that need to be prepared for.
That's
And
right. That's right.
yeah.
I remember reading something about, um, well, it was like many first graders are already making career decisions. They're deciding that they want to work outside, they want to work inside, they want to carry a lunchbox, they want to have a computer, whatever it is. Our kiddos need to deserve to have those same kind of experiences and
It's too
opportunities.
late to start thinking about what you want to do when you're 16.
That's right. Mm-hmm.
Yeah. You don't need to have a decision at 16 for any 16-year-olds that might be watching, but you need to have been considering it.
That's right. That's
Yeah.
right. Yeah.
What is
Mm-hmm.
your favorite area of the ECC?
Well, you don't know, but when I went into my graduate program, I would have said it was career ed because it was a totally ignored area.
Hmm.
But I've kind of come to think more more, I guess, the independent living skills area because. And you and I have talked about this before. I mean, I don't know which comes first, but that seems to be an important avenue. Teaching those skills to very young children seems to be an important attitude towards developing career, social,
Hmm.
self-determination skills. That when you can do it by yourself, what you can do by yourself, or as independently as possible, brings you the feelings of both competence and confidence. And
Hmm.
it's when you have confidence and confidence that you can bridge out and do more and more for other
Yeah.
people, for yourself, for your community.
I was debating in my head whether that is more foundational or whether self-determination is more foundational, because then you got to like request certain things to get the independence, but then also
That's right.
O&M so you can get to the places.
So I used to do this. Presentation, or I used to almost start every single presentation with the same slide, and it would be, children need instruction in the ECC. Um, the ECC skills are all intertwined. You can't really teach self-determination all by itself. You have to have people there to interact with. So
Which
now
then
it's
you
a
got
social.
social skills right there.
You
Yeah.
need to decide where you want to go. You need to have a goal, which might be a recreation and leisure goal. They're all intertwined, and they also develop over time. They evolve. They don't just occur, and that's what we were talking about earlier. You know, a child who's learning how to put his or her clothes on when he's 3 isn't done with clothing learning, right? There's
Oh
more
yeah.
skills to be learned. I mean, and even a fifth grader who can get himself to school, dressed to school, still doesn't know anything about a cummerbund or
Yeah.
a prom dress or, a strapless bra, any of those things that, go
Dr.
with being
Lewis.
an adult. I'm sure you're teaching your students that.
Boy, I'm not. I'm telling other people that they need to be, but that
Okay.
is
Well,
certainly
sure.
not where I'm
As
where
long
I'm
as it's
getting
getting
in.
taught, that's what I want.
Yes, certainly, certainly.
So they all evolve. They're intertwined. You've got to teach children to be in control of their own life, and I guess that's that self-determination piece.
Hmm.
And it has to start early. Yeah.
All right. Well, this has been such a lovely conversation, Dr. Lewis. There
Oh,
is always one question I ask people at the end of an interview, and that is, what is your favorite part of your job? And you've been in this job for some time, so feel free to look over the whole breadth of your career.
gosh. Okay. When I was a teacher, and again, I still consider myself a TVI at heart, um, it was always that wonderful feeling you get when the child gets what you've been trying to get him or her to do. I remember holding a child who had multiple disabilities. He was maybe 8 years old. He was in a pool and he floated for the first time as I let my hands go. And that was like, just, he was excited. I was
Yeah.
excited. I've never forgotten that. And so that part, when I was a real teacher, was certainly my favorite. And I guess as I went and worked at the university, I could say it's the same thing there. It's been able to watch graduates of our program go out there and really embrace the ECC and believe that it's foundational to these children's lives, that you could always learn history and social studies and some of that other stuff later, but these other skills are really important if we want children to be as independent as they potentially can. So,
Well, just think about how many of those aha moments you have facilitated through
yeah,
us, through your college students. I mean, I have to imagine thousands, if not millions, of individual little moments that could not have happened without you. So I just want to take a moment again to thank you so much, Dr. Lewis, for
thank you.
A, I mean, you're the only reason I'm here, not only because I am interviewing you, but because you made me the TVI that I am today. So thank you again.
I had a lot of help, but and you came in with a lot of good skills. So, but thank you, Alex. That's really kind.
And thank you again to everybody at home for watching another episode of Teaching Tips Tuesday. We hope you have a great week, and we'll see you next time.